Hey everybody, welcome back to another episode of Health, Smoke, and Mirrors. I am your host, Dr. Mike, and my clinic is where I'm shooting this at is Platinum PT. You can look me up at drmichaeljsardo.com. And what we're going to be talking about today is actually a pretty interesting topic on testosterone levels and how it can affect both men and women. Mostly it affects men, but it does affect some women in different ways. I'm going to start off with how it affects women, because I think that it's really interesting how it's being used for women. And some of my female patients that come in to see me have complained that in the past that they have had very low energy levels. Now, some of them have gone through menopause, and with that their estrogen levels have dropped to almost zero, and that's what I've been told by them. And so in that drop in estrogen, they have a significant drop in their testosterone. Now, women do have testosterone. It is at very minimal amounts, nowhere near the amount that men have. And in their estrogen is obviously way higher than what men have, which gives them female characteristics and traits, and testosterone gives men their masculine traits, etc. So with women, when they go through the menopause, their testosterone levels basically plummet along with the estrogen. So what they are being prescribed is a very low dose of testosterone that helps to regulate and balance out the estrogen, because testosterone will convert into some estrogen as it metabolizes in the body. And so this kind of helps keep them a little bit balanced, and which is a good thing because it helps with their energy level. That's what I mean by balanced. It helps with their energy and keeps them in focus with those things. And now that's really very interesting, because you would think that they can just be prescribed estrogen, but again, it's like a seesaw. It has to be, it's not just one-sided. You can't just boost the estrogen and keep the test low, because without any testosterone, now you're still in a massive deficit, where you're going to see a lot of impairments happen in that side. And low testosterone in both men and women is no good. And I don't care what anyone says at this point. There's enough out there that low test is just way worse than it being too high. So for females, that's what they got to do. They give them a little bit of testosterone, very minimal, and it helps to regulate the T levels and also their estrogen levels, boosting energy. And it's made big changes for the women that I've talked to, at least, that I've seen who've shared that with me. And I think that's just the coolest thing. And I'm glad that they have had practitioners on their side prescribing it for them, because a lot of times it's not being prescribed. It's not even being looked at, especially in men. So it leads me to my next segment here is low testosterone in men is extremely devastating. Low being subjective, because you could be at the top of the chart, and for that particular male, it may be low. It's not about the number on the chart. It's a guideline, and it's not how it should be. You have to remember, back in the 1900s, before all this processed food and all this garbage that people consumed within their diet, and with their visual diet and their nutritional diet, the test levels were 1200, 1400, and that's what they were doing in World War II, was giving the soldiers a pound of meat, and it was their test levels were super high, quote unquote, and it was providing them faster healing times, more energy. They weren't unhealthy by any means. And so it's interesting that some studies have shown that low testosterone obviously is really bad. But low testosterone is bad because it creates a lot of cardiovascular problems, a lot of cholesterol issues. And they've shown that actually increasing that testosterone level to something more normal, something more stable for that individual, helps with this cardiovascular system. It actually helps to reduce bad cholesterol levels and buildup. It actually helps to increase insulin sensitivity, which helps with diabetes. So this leads me to a story that the people have asked their physicians, and me included, has asked physicians, check my test levels, and you're been scolded. Well, why do you want to do that? And well, why not? It's my health. Yeah, I'm an adult male. I want my levels checked. Why are you going to fight me on it? Don't tell me jack about the insurance is covering it or not covering it. I'll pay out of pocket, honestly. And I think that every man should have their test levels looked at, especially if you're a male who's low energy, unfocused, sluggish. You may have a little bit extra adipose tissue, especially if you're active. Some doctors say like, oh yeah, you're normal because you're in range. Well, they're treating a piece of paper. They're not treating the patient, and I don't think that that is ethically or morally correct. So make sure you find yourself a good physician who's going to listen to you, your symptoms, and do the proper testing, because low testosterone levels is it's not good. And so actually one of the studies here by Goodall et al. Is showing basically that the existing data suggests testosterone therapy may have good cardiovascular benefits, not so much risk as they've kind of brainwashed all of us to think in the past. And so with that, you want to have those levels checked, and if you need to get on some kind of testosterone replacement therapy, it is a lifelong commitment, but that lifelong commitment will give you so much more benefit in the long run, better quality of life, better mood, stable mood, improved muscle mass, because this is going to, when you're on TRT, you're going to want to be active, and trust me, you're going to have so much greater benefits. And it's when you start to notice your energy levels increase and you start working out, the TRT just enhances everything. You just, overall, your life is going to change and just be fantastic with it. I'm not condoning the use of illegal testosterone by any means. You always want to have your blood work checked and be under the care of an appropriate physician and provider. But when you boost those levels up, the best results are going to be coming from activity and doing things. You run more of a risk if you're sedentary and you're doing testosterone, because, well, it's not how it should be, and you're lazy if you think that testosterone is going to solve all your problems and you're not being active and doing anything. The other thing too that I found was really interesting in another study here, that opioids can lower testosterone. Now imagine this: why would someone be on opioids? If they're using them recreationally, that's one issue, and that's a problem. You shouldn't be doing that. But if you're being prescribed opioids for pain, your testosterone levels will actually drop. And now when you have low testosterone levels, you're more sensitive to pain, meaning that your opioid usage may have to go up because you're not able to regulate your pain. And it's really interesting that increased cortisol levels from pain, stress, and anxiety will also decrease your natural testosterone levels. So do you see the loop here that the sick care system wants you to be in? It's not healthcare. They don't care about your health. They care about their bottom line and keeping you in their system as long as they possibly can, so that you keep coming back, keep buying the drugs, keep lining their pockets, and the pharmaceutical companies just keep making more and more and more money. Now, if a pharmaceutical company were to give you testosterone replacement and you're on that for a long time, do you really think that they're going to make as much money off of someone who's an addict and has multiple issues that they just keep pumping like 5 or 6 plus drugs on? I don't think so. So it's really interesting just to see the loop, guys. You have to really pay attention to it, to some of these things, and that's why I'm here to inform you all, because a lot of people think that testosterone is a steroid, it's bad, they've been told so much negative stuff about it, but in reality, it's the key to longevity, and with longevity meaning healthy, optimal longevity, and that includes having healthy muscle mass, lean muscle mass. That is a direct indicator of a good quality of life. You have better sleep patterns, better quality of life, better sex life, better active life with whoever. You're able to endure more. You just better metabolism. Less risk of stroke and heart attack. There's just going to be so many benefits that come from being active and being able to lift weights and move. You stay on your feet. I've said it before. When you can stay on your feet longer, you're going to live longer, because the second your legs go, you don't have any muscle mass in your legs or activation in the glutes in particular, then it's all downhill from there. But it was just an interesting read to see that that opioids really caused a bit of an issue. And this was a study by Choi and Lee, the modulation of pain sensation by stress-related testosterone and cortisol. They did electric stimulation as pain, and they found that those who had higher testosterone levels actually didn't have as much pain compared to those with higher cortisol levels. So in regulating your stress and anxiety and decreasing the cortisol and finding ways to increase your testosterone levels, the better able you are to tolerate pain. And so a lot of people with chronic issues, chronic pain, the first thing they're doing is throwing drugs at you to mitigate that pain. So pain's going to create a stress response and an anxiety response, and there you have it. You're dropping your testosterone levels already with that, and now you include an opioid on top of it, and you're going to drop your test levels even more. And just think about what this does for your overall mental health and your overall physical health, because you can't work out now because you're too sluggish and you're in pain, and you have no drive to do really anything because your testosterone levels are just tanked. So again, negative feedback loop. I hope everyone kind of caught on to that as I described it earlier. And again here, it's really important to have these things looked at, and you really want to work with someone who's an expert in dealing with musculoskeletal, neuromuscular injury to have you work on your stress response and to work on your pain, because once you really mitigate that pain and start to move and start to load the tissue up, now what we're doing is you're repairing tissue, you're restoring a better signal to the brain that's going to say, hey, we don't have as much pain, so now your hormonal response isn't going to be increased cortisol. We want your testosterone levels to come back up to normal with everything. And in doing so, you're going to be able to better tolerate the pain. And now you're loading the tissue, and now you're restructuring that tissue and repairing it, and now you're eating right, which is helping to modulate your hormones. This is for men and women. And that's a positive feedback loop that we want to see people in. This is a good, healthy, optimal feedback loop that's going to be something that's a lifestyle of healthy living. It's not just popping a pill to mitigate your pain. You're doing a lot more damage with all of that than you are anything else. So I really want to make that, hope that I really nailed that point for everybody. And you can see that you got to find a practitioner who's going to listen and who's going to check for the appropriate levels, especially if you're feeling sluggish and anxious and those things, because that's just going to increase your cortisol, decreasing your testosterone. But also at the same time, someone who's not going to push pain meds on you. And you want to find someone who's going to be appropriate to help you manage your pain, because that's going to disturb your sleep, that's going to make you irritable, more stressed, increasing cortisol, decreasing testosterone. Now they throw an opioid at you, and there you have it. That's just a recipe for disaster. So it's really important to regulate these things, and don't be so afraid to ask your doctor about testosterone. If they're reading off a piece of paper saying that those levels are normal for you, they might not be. They might not be optimal for you. There's nothing wrong with boosting your test levels over the paper said limit, or the FDA recommended limit. That is a max testosterone level in men. It differs for everybody. And if you're at 800, which is probably the top end of the chart, I think it goes to 825, and they say you're normal, but you feel like crap, and you have all these other underlying symptoms, find someone else, because you have to get that regulated. And honestly, it's going to help men to put on lean muscle mass and burn fat, and that's going to create optimal longevity. And for women as well, if you don't have any estrogen, no testosterone, and now you get put on it, be active, because it's going to help regulate all of those other areas. And it's going to help you maintain good and healthy muscle mass as well, which is, again, important for both men and women in longevity, to have good, healthy muscle mass. That is a true direct correlating factor between your quality of life as we age, whether it's really, really good or really, really bad. So I hope you guys took that and run with it, and it's good information for y'all. If anyone ever has any questions, you can always shoot me a DM on Instagram at DocSardoDPT or SardoPTDPT@gmail. Send me an email, and I'd be happy to answer any of your questions But yeah, guys, I'm going to post the links to these 2 studies that I talked about in the show notes here, so you can take a look at the studies and make your own conclusions. So if you want to discuss it, great. Anything negative you have to say about it, I don't care. Don't leave those comments. They'll be deleted. I don't really give two dookies about your negative opinion on anything. Let's have a professional discussion about it, and I'd be happy to learn something from you, maybe, because I know that there's so much information out there and so many different ways to interpret things. So thanks for listening, and I hope you all have a great, wonderful day, and we'll catch you on the next episode of Health, Smoke, and Mirrors. See y'all.